the country is seeing a concerning rise in measles cases, with over 700 laboratory confirmed infections reported nationwide so far this year. The hardest hit province is Gauteng, followed by the Free State and Mpumalanga. Now, health authorities are raising the alarm as the majority of these cases are affecting children between the ages of 1 and 14 years old. Now, helping us to unpack this further is Jack Manamela, epidemiologist at the National Institute for Communicable Diseases. Mr. Manamela, thank you so much for your time. Just speak to us about these concerning factors. I mean, what are the key factors driving this sharp rise in measles cases across the country?
Yes, good afternoon. The increase in the measles cases is mostly due to the low measles coverage in the country. So that made the increase in the number of people who are susceptible to the measles infection to increase. And those mostly just been seen after the COVID-19, where we started seeing the hesitancy in vaccination, and we started seeing more people being reluctant to vaccinate, and that led to the low measles coverage in our communities.
And that is of concern. I mean, you're raising two concerning issues: low measles coverage in its own, as well as vaccine hesitancy post COVID-19. Let's talk about why children between 1 and 14 years old particularly are vulnerable in this outbreak.
Some of the children that are between that age have missed their vaccination during COVID. But the other thing that led to that is that after COVID, when parents are not taking their children to the healthcare facilities for vaccination, led to the increase in the number of children that are not getting vaccinated, and that led to them being vulnerable to being infected with the measles virus. And the other thing that we have observed is that when the Department of Health also does some vaccination drives, in some instances, the people at schools, they are given forms that for the Department of Health to vaccinate those children, they need permission of the parents. And some of the parents are not really signing those forms. And that affects the measles drives that the Department of Health is doing to go to the schools and try and assist in vaccinating those children who are not coming to the healthcare facilities.
Yeah, in terms of just the public health response, and you've spoken a little bit about it early on, what measures are health authorities putting in place then or measures they should put in place, to contain the outbreak and prevent it from spreading to other provinces? Because we know, of course, the most affected provinces that we're being told with the highest numbers are Gauteng, the Free State and Mpumalanga at this point in time.
Yeah, in areas where the measles outbreaks have occurred and the other hotspots, there are measles outbreak response teams which also do contact tracing. And when they are doing contact tracing, they are vaccinating those contacts regardless of their age, just to make sure they protect those people who got in contact with the laboratory confirmed measles cases. And also what they do is, depending on how many people are there, including those in schools, they will go and vaccinate those contacts. It's some of the measures that they do to protect the community by increasing the immunity around that confirmed cases. And currently in Gauteng province, which is mostly affected, they have started with the measles vaccination campaigns in schools as part of protecting the communities and trying to reduce the risk of the measles spreading to other provinces. But the same thing is also done in hotspots where the the measles catch-up usually is done, and those cases that are contract also are vaccinated.
Yeah. Just going back to your earlier comments around vaccine hesitancy, particularly because of, post-COVID-19, some parents, rightfully so, in some instances, are hesitant about vaccines. But what reassurances can you give to communities about just the safety and the effectiveness of vaccines in this point?
It is known that the measles vaccine is highly safe, and then it has been used worldwide. It's not only in South Africa. And it also has been proven that it's protective to prevent measles cases. And the other thing is that it doesn't usually give the side effects that are very, let me say that the side effects that usually some of the people who got the vaccine get is only mild sore at the injection site, and some they might just develop fever when the immune system starts producing those antibodies that are due to the measles vaccine.
All right, Mr. Manamela, let me thank you for your time. That is Jack Manamela from the National Institute for Communicable Diseases.